This is the third comic video for the European Society of Endocrinology and Endocrine Society Joint Clinical Guidelines for Glucocorticoid-induced adrenal insufficiency. This video will cover managing patients who are stopping glucocorticoid therapy and diagnosing glucocorticoid-induced adrenal insufficiency and withdrawal syndrome. For short-term glucocorticoid therapy lasting under 3 to 4 weeks, doses do not need to be tapered regardless of the amount. Patients can safely stop the medication without tapering or testing as the risk of HPA axis suppression is low. In patients on long-term glucocorticoid therapy, doses can be tapered to approach the physiological daily dose equivalent. This should only be done if the underlying disease is well controlled and glucocorticoids are no longer needed. When tapering off glucocorticoids, be aware of the potential for withdrawal syndrome. If severe withdrawal symptoms occur, temporarily increase the dose to the most recent tolerated level and extend the tapering duration. Withdrawal symptoms such as joint pain or weakness can overlap with those of glucocorticoid-induced adrenal insufficiency. This makes it hard to tell the two apart. Routine adrenal function testing is not recommended for patients on high doses of glucocorticoids or if they still need the medication for their underlying disease. Switch from long-acting glucocorticoids like dexamethasone to shorter-acting ones like hydrocortisone when they are no longer needed. This helps with gradual tapering and better recovery for their HPA axis. Patients on a physiologic daily dose of glucocorticoids who want to stop can either gradually taper the dose while monitoring for adrenal insufficiency or get a morning serum cortisol test. When confirming HPA axis recovery is needed, a morning serum cortisol test is recommended as a first step. High serum cortisol levels indicate better recovery of the HPA axis. Routine dynamic tests for diagnosing adrenal insufficiency are not recommended for patients tapering or stopping glucocorticoid therapy. By following these guidelines, healthcare professionals can effectively manage glucocorticoid discontinuation. This approach helps minimize withdrawal symptoms and ensures patient safety. Please watch the remaining videos in this series and scan the QR code below for more information.